My talk here is on a topic which is monotherapy, and whenever I talk about monotherapy, especially in the field of Ayurveda and presence of Ayurvedic doctors, the first query that I get is in Sanskrit it is written Maryanti iti Marmani. That means if there's a trauma on marmas, then there are chances of disability or even death. So why are you treating it? Why are you touching this? Marmas basically, what Ayurveda has believed or has always advocated is a seat of prana or the seat of vital energy. Then if it is written that then if there is injury on that particular spot, that such and such disability can happen, what is the reason, what is the logic behind it? So I would say that the symptoms or the factors which are written by Shishir is marma abhighat. It is the severe trauma on those marma points. Of course, the heart is one of the marma points, and if you cause a severe injury on heart, of course, death will ensue.
Okay.
But we are not causing any specific trauma on the marma points. We are just stimulating those marma points because they are also the seat of prana. So we are rechannelizing those energies. Basically, monotherapy is an energy science. The basic concept, just like yoga also, and around 35 world over there are energy healing therapies, all having scientific basis. Similarly, marmas also have a scientific basis. Of course, you will ask them what is the relationship in Ayurveda and what are the contexts in Ayurveda on which basis you are treating it. So, one of the inferences that you can infer in the relation to marmas is that we are also using our yukti because it is said in Shashti Ukram, Adyo Vipnaparam. So in any treatment protocol of Grana Chikitsa or in the Shishir Tantra, it is written with Adyo Vipnaparam. So in matter, when we are stimulating this marma points, we are also doing this first aspect. Now, why are we doing them? Several ways in which a marma therapy can be practiced and or can be stimulated, but we are doing it with our digital application of pressure because Sushruta has said again that hastameva pradhanatam yantram, our hands are the best instruments. So of course there are ways like pranic healing, or you can do it with the aroma, you can do it with some gen therapy. It's basically you're realigning the energy channels. So there are several ways. But I am doing it with the help of energy, my digital application of pressure. There's of course certain techniques of the stimulation in certain marma points, how much pressure that is to be applied, and how much, what is the direction of the pressure, and all those things have to be taken into consideration, whether children or whether as an adult or obese or different physical body. So we have to take those points into consideration. Before going further in this aspect, I would just like to show you a couple of videos, and then and I have also a workshop afterwards, so I will explain those marma points and what we are doing. I'm skipping these slides, I'm just coming to the video. This was a patient of secondary frozen shoulder I treated in Mexico. You can observe the before treatment, the range of movement of arms of the patient. So he's having pain and saying, so the different range of movements is what you have to observe here, and pain in the face. Immediately after treatment, you will see the range of movement has improved to around 25 to 30 degrees and even more. This is just after first sitting of monotherapy. Irate says, or people think in general, like it takes a long time to act. Okay, you give around medicines for 2 months and 3 months, and then it will start acting. But if we include monotherapy, especially more, which I've seen in my clinical practices in the musculoskeletal disorders, neurological disorders, associated with musculoskeletal disorders, then we get much faster relief. So the said lacuna or considered lacuna, which is people think that it takes long time. Sometimes we use it to our benefit when a patient comes to you and he doesn't get benefit, and we say, okay, don't worry, Ayurveda will take 3 months time, so it will happen, no, don't worry. So not like that. There are other diseases in which you'll have to include certain medications also. Of course, we are using Ayurvedic medications only. And depends upon also the chronicity of the disease and the associated other pathological factors. The next question which I am asked most of the time, okay, you were able to give this patient this relief, how long do you sustain it? Okay, so in the next video we will see here. So basically, thank you. So I did this patient monotherapy once when I was in Mexico. He's basically a German guy. And I came back and I taught this patient, see, you have to do these marma points on yourself. Okay. And this patient followed it up on his own. I didn't go and do it and didn't give him any medication. This patient, when he came to me, had lost almost all hope that his shoulder will ever improve because it's already been more than 6 months. So the best part of this is the fact that I can teach a common man. You, as a doctor, can teach a common man that, see, you can help yourself in this manner. When the science is combined with simplicity, the reach is quite wide. We all know that the medical care system is getting costlier and costlier. If I can teach my patient, see, you don't need to come always to me, you can do this point for this disease. So you can imagine the cost of burden of the overall of expenditure the patient has to come. Many times the patient cannot even buy their medicines. So we need to incorporate certain simplistic manners in which the patient help themselves. Of course, we will sometimes, in such patients, if they are in India, I'll call such patients to my OPD or my clinic, and I'll teach them for 1 week. And then they can do on their own. So it's not that you learn it in one go. You have to follow it up for, say, 1 week or maybe some 10 days, and then you can follow it up later on your own, and then come back again to me after for a longer duration if you need any more advice. So this is not only one case, there are many cases like this. One more, okay, this is this photograph I will pass. So this is another one. This lady who came to me from when I was in.
Thank you so much, sir. Without any officially demonstrating his treatment protocols in the afternoon session. And moving forward, I would like to we would like to felicitate Dr. Shishir Prasad, sir, and I would request Dr. Ashwin Barot, sir, to felicitate Dr. Shishir Prasad, one of our keynote speakers. Dr. Shishir Prasad, sir, we would like to felicitate you, sir. That is the beauty of Vaka, sir. that you talk about and you talk with people and you get to know more people, more and more Ayurveda fraternity people. We have with us Dr. Anuj Jain sir from Gwalior, who is an emerging Ayurveda practitioner and works has